aren't.
When we are struggling with health-related issues, many Americans are not willing to visit a doctor as they know what the consequences price-wise is going to be if they cannot afford the insurance. In today's society, we're paying more for everything from healthcare, visits, and insurance to avoiding professional medical care and not being given a healthy life. As an American who is luckily under my parents' insurance, I've been able to see prices of healthcare and other medications rise as I am living apart from my home now. When you don't have access to insurance through work, it can get expensive, but will save you thousands if needed to be used. But we are seeing an increase in nearly every product and service that is including a dramatic rise in insurance prices, making thousands of people struggle when sick because they know how much it may cost them when they visit the doctor. Visiting a doctor can become very expensive, and an increasing number of Americans are holding off as long as possible to avoid the costly visit. Our health is one of the most important aspects that keeps us going in life, and healthcare should be provided to all citizens of the world, or we would not have the freedom of life. All points of healthcare are not affordable and are only getting more expensive. Affording an insurance policy can become very expensive for a family, especially if not covered by an employer. The average cost for a family health insurance plan offered through an employer jumped 7% this year to $23,968. And insurance costs for an individual rose 7% as well to nearly $8,500. That was according to the USA Today survey of this year. More than 150 million Americans receive health insurance from their workplace. The insurance price increases are far less than the double-digit rate increases that we were routine during the first part of the past decade. Companies pay for the vast majority of the health insurance expenses and use those benefits to attract and keep other employees. The cost of health insurance is based on how much insurance plans pay for bills from hospitals, doctors, prescription drugs, and other medical services. It was also said that with rising costs this year, some consumers will likely see higher price in the next coming weeks when their employers start enrollment for 2024 health insurance plans. The survey said nearly 1 in 4 employees or employers expect to share a portion of those higher costs with employees who might see a larger paycheck deductions at times when inflation still outpaces wages of growth. Making thousands of people struggle when they're sick and because they know how much it may cost them to visit the doctor. Avoiding the doctor will keep you from having to pay for any prescriptions and other tests that may occur during the visit. Many Americans will do all they can do to avoid the doctor getting prescribed medication due to these prices. Purchasing other medicine from your local grocery store or Walgreens will be much cheaper, but possibly less effective than a prescription. Income is the largest effect on this. Americans with a household income under $40,000 were near twice as likely as those of an income more than $100,000 or more to say because someone in their family delayed medical care for a serious condition. The spread was 34% to 18%. There are also significant age differences, according to the news.gallup.com, of postponing care in 2022, with young and middle-aged adults much more likely than older adults. This is likely due to the fact that Americans aged 65 and older are covered by Medicare, and a new 35% of adults aged 18 to 49 said that they or someone in their family put off the care, while 25% of those aged 50 to 64 put off the care. Looking at gender differences, in 2022, 32% of women and 20% of men reported putting off medical treatment, representing the 12-point increase from 2021. Women and a 5-point increase from men, which I thought was very interesting because I figured it'd be the opposite, that more women would be going than men. Overall, with the high inflation creating moderate to severe hardship for majority of Americans in the second half of 2022, there are reports of delaying medical care in general due to cost, as well as delaying this for a serious condition. Among all the rights of which we are entitled, healthcare may be the most intersectional and crucial. The very fertility of our human lives demand on what we protect this right as a public good. Universal healthcare is crucial to the ability of most marginalized segments of any population to live lives in dignity. In the United States, we cannot enjoy the right to health care. Our country has a system designed to deny, not support, the right to health. The United States does not really have a healthcare system, only a healthcare insurance system. Nearly 3/4 of the world provide free healthcare to citizens, and I feel the U.S. is strong enough and can put money into healthcare. The right to healthcare has long been recognized internationally. Ironically, the origins of this right are here in the United States. Healthcare was listed as the second Bill of Rights, drafted by Franklin D. Roosevelt. Sadly, his death kept the second Bill of Rights from being implemented. The American Bar Association conducted interviews while collecting stories. They spoke to many people, such as one lady, 27-year-old female from Vermont. She said, "I simply don't understand what happened. I was told that the ACA would let me get the health care I need. I pay my premium every month. Now that I'm really sick, I can't go to work and have very little income. It turns out I can't go see a doctor without paying because I haven't spent $2,000 this year out of my own pocket." So even after paying premiums, which are thousands of dollars already, and paying the $2,000 deductible, she is still having to pay money out of her own pocket. So now that you've seen many reasonings on why the U.S. must look into providing free healthcare to help all citizens, including those that may not be able to afford doctor's visits or unable to afford or access to insurance, and understanding why United States is one of the few countries who do not provide a free healthcare as a human right. So now I encourage all of you to understand the impact that this has on our lives and go make a change.